Hi, I'm Dr. Brooke Adams, and I'm a licensed clinical psychologist and the clinical director of Totality Treatment Center. Group therapy is such an integral part of the whole therapeutic process because, oftentimes with, struggling with mental health or whether someone struggled with addiction, it's so isolating and lonely. And so when you come into our doors and you feel a sense of being embraced and a sense of belongingness and that it's safe to be yourself, to get vulnerable and to open up, that's the birthplace of real healing because clients can feel like they, are able to be themselves and be accepted for who they really are. And the group therapy process can be such a microcosm for how they interact in the real world. So being able to heal on the group level, get the support, compassion, and feedback can be such a powerful part of the process. In the group therapy process, clients get a whole kind of variety of different interventions. They're hearing from one another, they're dialoguing back and forth, they're able to ask a lot of questions. And, even from an emotional standpoint, they get to be accepted and embraced for all the things they may have kept secret or maybe they had shame around. And when someone feels accepted for being exactly who they are, all the things, the good, the bad, the ugly, and everything in between, really it can help people go, okay, this is not only safe, but I can actually open up about the real things that I need to face that I've probably been avoiding for a long time. Any treatment center, we can have all the best gold standard evidence-based therapies, interventions, and none of that really matters unless the client feels safe. So that's the first and foremost priority. So we do that in a few different ways, but first we just lead with our hearts, with compassion. We really assess that client from a holistic perspective. We want to know what's important to them. What are they here for? What are their fears, their barriers, their motivations, and help them to find purpose, meaning, and let them know that this is a safe place where they can come as they are, and we're going to accept them and help them reach their goals. So 2 of the evidence-based interventions and modalities that we use are based in CBT, which stands for cognitive behavioral therapy, and DBT, dialectical behavioral therapy. They're both similar because they employ challenging thoughts. Cognitive behavioral therapy really looks at the relationship between thoughts, feelings, and behaviors. So we target things like, negative self-talk, cognitive distortions, such as all or nothing thinking or catastrophizing, for example. And we challenge that and teach them how to reframe those thoughts to lead to better emotions and consequences and choices in their behavior. Whereas DBT really helps clients who have emotional dysregulation or borderline personality traits, such as, high intensity of feelings. DBT really employs mindfulness. So it starts with focusing on how they can respond instead of react. So teaching a lot of grounding, incorporating spirituality and a sense of kind of mindfulness into all of that. Our therapies and the different modalities we use here at Totality are aimed to help the client from a holistic perspective. We're going to take a look at all factors and variables that lead to the diagnoses that they have. We're going to look at the family system. We're going to look at their social situation. We're going to look at, what are the challenges and the outside kind of real world issues they're dealing with now. We're also going to take a look at like the neuroscience, and we have a lot of diagnostic modalities that we employ, such as an EEG to kind of determine if there's biological issues or medical concerns. We also have other therapies such as like TMS, which stands for transcranial magnetic stimulation, that we can employ to really treat that whole person. At Totality Treatment Center, we really treat the total person. We look at them from a psychological perspective, psychiatrically. We look at their social world, their family systems, the way they grew up, all the structures that kind of got employed that just aren't serving them today. And we wrap around them with love, compassion, and evidence-based care to ensure their medical, clinical, psychiatric needs are all met. Again, we've got some other modalities that we can also employ, such as TMS and EEG biofeedback, that can really kind of be the supplement that may be the missing puzzle piece prior. Most clients who come through our doors do have co-occurring disorders, which is a fancy word for just saying that there may have been a history or present substance use disorder, as well as the psychological underpinnings and the mental health diagnoses. We really take a look at all of the diagnoses that the client has, build treatment plans tailored for those specific issues, and ensure that we carry out the delivery of treating all of the symptoms we're seeing. So when it comes to treatment, individualized care is really important. That means we do not give kind of a cookie cutter, treatment plan. We don't treat the client like a number. We look at that whole person. We look at all the factors in their life. We look at their dreams and hopes and what's going to give them purpose. And we really cater around what's important for that client, what will give them a newfound sense of freedom and, helping them to rediscover who they really are and who they can be. And our journey together is to help them get there. And there's nothing greater than watching a client get the lights back in their eyes. Sometimes they come in essentially at their most broken. And when we get to walk by side and see that kind of the sense of freedom come back to life, it's just, there's nothing greater. And that's why we all work here, because we love helping other people. And I believe there's no greater currency than impacting another person's life, helping them to find that sense of freedom, purpose, and meaningfulness in their lives, get their families back, get their sense of confidence and self-esteem back. At Totality, I really am so proud to work for such an organization where we prioritize integrity and client-centered care first and foremost. It's the most important thing to me because I know in this industry and working with this kind of population, you have to know the right questions to ask the treatment center and, ensure that you're going to be able to get that care. And, I can say firsthand that this is a place that is special. And you feel that when you enter these walls. The clinical team really leads with heart, compassion, and the clients feel that. And it's just such a reward when we hear that gratitude expressed to us, because it kind of makes us go, yep, we did our jobs and that was conveyed. So it's really cool to watch. Also, it's really wonderful and rewarding when we hear from our alumni, maybe it's months or years later, and they say, hey, thank you so much. I'm taking my 2-year cake. Or, look, I had a baby and I'm, got the dream job I was looking for. It's so wonderful because we've got to meet them, when they're at a very different point in their life. And just to watch people get their lives back, it's nothing greater. And we're so proud of the clients that, engage in this program, make the most of it, maximize their time here, because there's a lot that we have to offer. And when they take advantage, it's really cool to see.